Affordable housing is a critical issue often ignored by policymakers, both Democrats and Republicans alike. You might not realize it, but your housing situation impacts so many parts of your life. It not only decides your economic stability, but also your access to good schools, good jobs, quality air, how you're policed, family planning resources, and most importantly, your health. In fact, the strongest indicator of health outcomes is where you live. As a doctor serving lower income communities all across Northern Virginia, I know firsthand how intertwined your healthcare and your housing situations are. Let's take a closer look at exactly how we can make healthier communities through housing assistance. But first, let's address the elephant in the room. I think you should definitely wear masks, but I don't think I deserve this. This is way too much. Now back to the issues. Housing's impact on your health can be boiled down to two main areas: cost and environment. Let's start with cost. When rent is too high, people can't afford the care they need, especially in a private insurance system. Households burdened by high rent are far more likely to be underinsured and uninsured. And the rent is too damn high. In Virginia, 4 in 10 low-income people are homeless or pay over half their income in rent. And this disproportionately impacts Black and Latino households. A huge reason for these high costs is a low housing stock. The Brookings Institute found that Northern Virginia is failing to meet new demands for housing because of archaic zoning laws from the segregation era. These racist policies have forced middle-income families to either spread their money too thin or endure long commutes. When you can barely afford a place to live, it makes it more difficult to be healthy. Because costs are so high, lower and middle-class families are forced into situations that make them sick. That's how the environment you live in affects your health. Middle and low-income housing tends to be far away from grocery stores with nutritious foods and safe places to exercise. Cheaper housing conditions are often substandard and poorly ventilated. They cause higher rates of asthma and poor heart conditions to develop. And on top of all of that, low-income families are forced to overcrowd single-family homes, worsening the spread of infectious diseases like COVID-19. But don't just take my word for it. I spoke with Greg White over at Cornerstones, who's dealing with the reality on the ground. Let's take a listen. We are happy to have with us Mr. Greg White, Chief Operating Officer at Cornerstones, a organization that serves the greater Herndon-Reston and Northern Virginia community in the area of housing from all sorts of wraparound services, education, food needs, you name it. And so, Greg, thank you so much for joining us. I really appreciate your time.
Well, thank you. So I've been working with Cornerstones for 12 years. And, my motto is affecting change and to, as you say, make a better life for residents in our community.
We know that Cornerstones is a trusted advisor to our regional officials on affordable housing before COVID-19 hit. It's obviously impacted the work that you guys have been doing. So I want you to tell me a little bit more about that, how that's been playing out for you.
I think COVID-19 has impacted our services, but not stopped them. Our child care center, which serves 80% low-income families, did close for a few weeks and then reopened under guidelines from CDC. We also continue to provide housing and property management services for the 106 units of housing that fall under Cornerstone's Housing Corporation. We have stood up what's called the Cupid Hotel. It's a quarantine, protection, isolation, and decompression hotel. Decompression meant that we lowered our population at all our shelters to 50%.
Well, it sounds like there's a much more intense need for wraparound services as a result of all of this. Tell me a little bit about who are the people that need affordable housing at the moment that you see?
70% of the population we serve right now is composed of people of color and immigrants. So 60% of the folks that I described head of households are female, 8% are seniors, and 40% of all those individuals are children under 18. So the pandemic has been as you well know, particularly brutal in Latino and African American communities, and our stats reflect that.
It breaks my heart when I see people who are going through the cycle of discrimination that we can see in many different angles. You're talking about a lot of them, but at the center of it, a lot of it has to do with unable to afford good housing, and a lot of times unable to afford good health care. And so ends up putting people in situations which they don't want to be in. So what things have you been thinking about that would ensure better access to affordable housing and mitigate the racial inequities at the state level that I could be doing that Cornerstone recommends for me?
On a more macro level, yeah, it is about us acquiring and preserving affordable housing. And when you invest in affordable housing, you also invest in the children in terms of breaking the cycle of poverty.
Well, we have a big coalition working on all sorts of affordability issues right now for housing, and I definitely want to come back to find some good stories. So looking forward to seeing you soon in full health.
All right. Thank you. Have
Take
a good
care.
day.
Thank you, Greg. Much appreciated. Thank you so much for joining us, Greg. For more information on what Cornerstones is doing in our community, visit cornerstonesva.org. Cornerstone's work shows just how bad the housing situation is, especially during our ongoing pandemic. So how can we fix this? First, we need to create neighborhoods that promote a healthy lifestyle. Parks and green spaces for exercise and easy access to healthy groceries promote happier and healthier communities. Second, let's expand affordable housing. We have to keep up the push I started last session with eliminating single-family only zoning. We as Democrats have a duty to push back against Trump's racist dog whistles with the suburban dream. These policies are not only relics of the segregation era, but they make housing more expensive for everyone. Of course, this is an urgent issue. That's why I'm building an economically and racially diverse coalition. Together, we will end housing inequities once and for all. Join us by signing up for my weekly newsletter to stay up to date on the issues and to find opportunities to get involved. Visit our website, samirfordelegate.com, and if you can, donate to support our work towards justice. Thank you, and stay well.